This conference will now be recorded.
Welcome in, everybody. So for this session, we're going to be talking about utilizing the SAM splint, which is a movable splint for extremity injuries. So first, we're going to look at utilizing the SAM splint for the ankle injury. I have a 24-year-old male patient sprained his ankle while jogging. So I conducted my patient assessment, scene safety, BSI. We have an isolated injury to the ankle. I'm going to go ahead and utilize that SAM splint to mobilize that joint. So how it comes out, it's all rolled up. So I'm going to go ahead and flatten it out. And then I'm going to go ahead and ensure that I got some ACE bandages or some Coban in order to secure that. So we have a left ankle injury. Go ahead and check my CMS, inspect it, palpate it, look for any signs of deformity, decap, ETLS. Then I'm going to go ahead and start molding my splint around that patient. There, I got good fitting. I got a nice moldable splint. So now I'm going to go ahead and secure it utilizing an ACE bandage. So I'm going to wrap that all the way around. Ankle's nice and secure. Then I can go ahead and pin that into place. Now, for an ankle injury too, it's always best practice to go ahead and wrap up that ankle as well. So I'm going to take a second ACE bandage, do a couple of laps around, and then I'm going to come down and start going around that ankle. And then secure that in place. The ACE bandages always come with a little clasp. They can go ahead and secure your ACE bandage. So very nicely utilized for those ankle injuries, and then also arm injuries and wrist injuries as well. So we have a 24-year-old male patient, and they were jogging, sprained their ankle, fell, landed on their left wrist, complaining of left wrist pain. So what I want to do here is I'm going to roll this up a couple of times, and then I'm going to utilize the patient to go ahead and clasp that. So patient's clasping that. This is all the way up and down his arm. Now mold it. And then I can go ahead and secure that with an ACE bandage. The same thing that I did with the ankle. So I'm not going to go ahead and repeat myself. Again, be creative with these SAM splints. They mold them exactly how they're going to contour and fit to the body. Be mindful of those void spaces, utilizing those clings and other ACE bandages to fill that void, and then go ahead and stabilize them. Make sure that you're checking CMS before and afterwards. Whenever you're applying a SAM splint to an upper extremity, make sure that you're following that up utilizing a sling swab with your triangular bandages. That does it for SAM splints. Very easy, great technique to go ahead and splint those extremities. Thanks, everybody.